Welcome to the UCLA Health Simulation Training for Emerging Infectious Disease Preparedness. In this simulation, you will learn how to remove PPE for a suspect or confirmed Ebola patient. Properly removing PPE significantly minimizes exposure risk. Today you will learn the correct steps to remove Ebola PPE. In this simulation, you will be in the role of an anteroom buddy helping a patient room nurse remove their PPE. The safety monitor is standing by the door of the anteroom. They will tell you each step and you will tell the nurse in the patient room what to do next. You will also help the nurse with some steps in removing their PPE. Take a moment to move around the anteroom to familiarize yourself with where the safety monitor is standing and where the nurse is removing PPE in the patient room.
Hello there, I am Yasmin, your safety monitor. I will provide instructions to you as you help Omar, the patient room nurse, remove his Ebola PPE. Omar cannot hear me very well, so you will need to communicate each step to him. You will also help him complete some steps. You can access videos to review the details of certain steps by clicking on the video button.
I am ready to start removing my Ebola PPE. I'm not aware of any splashes, sprays or other gross contamination on my PPE.
Omar is ready to start removing his Ebola PPE. Continue by saying to the safety monitor, Omar is ready.
Omar is ready.
Thank you for letting me know. I will provide instructions to you. After I explain a step to you, please communicate each step to Omar and assist when needed. Do you and Omar have all the supplies that you need in order for Omar to remove his PPE? Check the boxes next to the supplies that you have available.
Which supplies do you and Omar have available to you for Omar to safely remove his PPE?
Great, you have all the supplies that you need. As a reminder, you and Omar will both do many glove changes throughout the process of removing PPE. This means removing your outermost gloves, sanitizing the next layer of gloves and putting on a new pair of outermost gloves. You will wear a third pair of gloves when helping Omar remove his PPE. Click on the box of short cuff gloves to put them on. Let me know if any issues come up when removing PPE. I may tell you or Omar to stop and wait for further instruction if we need to modify anything based on what I see. You can also stop and alert me if you have any concerns. The first step is for Omar to clean his outer gloves. He should use one disinfectant wipe at a time to wipe from the wrist area of the glove to one finger at a time and then dispose of that wipe. Then he should grab another disinfectant wipe and repeat as many times as necessary until he feels that his outer gloves are clean. For example, he can use 5 wipes to wipe the front of his left hand, then 5 wipes to wipe the back of his left hand and then continue to his right hand. Say to Mary, disinfect outer gloves.
Disinfect outer gloves.
The first step is to clean your outer gloves. Remember, take one bleach wipe at a time, wipe down the glove, and dispose of the bleach wipe. Do not come back up the glove. Repeat until your outer gloves are decontaminated.
I disinfected my outer gloves and feel that they are now as clean as possible.
Next, tell Omar to set up a chuck on the patient room side of the doorway. Say, set up chuck.
Set up chuck.
Now tell Omar to saturate the chuck with disinfectant. Say, saturate with disinfectant.
Saturate with disinfectant.
You now need to set up a chuck on the anteroom side of the doorway. This chuck is for Omar to use later in the process of removing PPE, when he will step into the anteroom. Click on the floor to place a chuck there. Click on the disinfectant to saturate the chuck in the anteroom. Omar will remove most of his PPE in the cleanest part of the patient room, by the anteroom door. Tell Omar to step onto the chuck in the patient room. Say, "Step onto chuck."
Step onto chuck. Step onto chuck.
Omar needs to remove his outer gloves next. You and Omar will use the beak method anytime you remove gloves. Watch this video as a refresher of the beak method.
How you remove your gloves is very important. You should consider your gloves contaminated even if there is no visible contamination. Improper glove removal followed by improper hand hygiene can lead